Good morning. Happy birthday. It's really very exciting to be part of a celebration, and I have a little bit of a sense of how far you've come and how much work it's taken to get you to this point. So I'm really very honored to be part of the introduction to your meeting. This is a landmark in really achieving the National Forum. First of all, to bring two organizations together, and secondly, to create that intersection with government and the organizations and all the stakeholders in this issue. The work that's gone on in just the first few years of your effort is really remarkable, and I know there is much more to do. I had the privilege with Janet a few months ago now, I guess, to attend an event in Atlanta, part of the RED project for women. It's really the largest convention of women for education and information about cardiovascular disease and stroke. And while we were sitting in an audience of, I don't know, several hundred women, mostly wearing red, lots of red hats, but I was also struck by the fact that almost everyone in the room was African American, and what a profound intersection between the diseases that are the #1 killers in America and the health disparities that those diseases reflect so remarkably, and particularly for women in the sense of all of the disparities that are not just on the basis of race but also on the basis of gender, the high mortality, the poorer outcomes, the trends moving in the wrong direction. So I really recognize what an important public health issue this is, and I congratulate you on everything that you're doing to be more impactful and to have a larger health effect. But I also recognize that we're doing this at a time when, in a sense, our portfolio is out of balance. And I say that from the CDC perspective, where we know we've benefited from extraordinary investments in our agency in urgent threats like terrorism and influenza and the things that are in the news every day, but we haven't experienced the same investments in the urgent realities like cardiovascular disease, cancer, stroke, tobacco, fitness, and nutrition. So our challenge is, how do we create this coalition and empower this coalition in an effective way, at the same time having to do that without the kinds of investments that we wish we could be making in the situation. And that means partnerships are everything, leverage is everything, and we know that as the CDC we couldn't possibly be successful without the efforts of this group. So thank you so much for your work. I would also like to say a few words on a sad note, really, about the loss of someone that you all know and I think respect highly, Dr. Lynn Smaha. We were all shocked to learn about his unexpected death, and I think this is an occasion that really reflects his commitment to these issues and the work that he did to help bring you together. We do express our deepest sympathy and condolences to those in the American Heart Association and, of course, his family. I understand that his life will be celebrated today at 11 o'clock in Athens, Pennsylvania, and I know that's an important issue for many of you, and there are some who couldn't attend the meeting today because they need to be there in person at the condolences. Dr. Smaha really was a champion for the prevention of cardiovascular disease. When he was the president of the American Heart Association, he really did a remarkable job, not just articulating the message for the United States, but he took on the international issues as well and really focused the lens on the global impact of cardiovascular disease and stroke prevention and treatment, and really worked so hard to develop those kinds of partnerships to bring us all together. When he was coming home from an AH mission to China, he wrote, I believe we in the United States must reach out and walk hand in hand with those in other countries to address the global burden of cardiovascular disease and stroke. And he talked about fashioning a battle plan to translate his beliefs into action. In further pursuits of his hopes for prevention, he represented the AHA on the board of the Alliance for a Healthier Generation, which was a big initiative with the William Clinton Foundation to prevent childhood obesity. And we only learned last Tuesday that he was back at the AHA meeting with Senator Specter's staff, where he was working passionately to help gender more support for prevention of heart disease and stroke. you, I'm sure, have many memories of him and are many opportunities to reflect on them here in the context of this forum. But I propose that we dedicate this fourth meeting of the partnership and the National Forum for Heart Disease and Stroke Prevention to the memory of our colleague, Dr. Smaha. I think he would be proud to have this meeting dedicated to him. It had meaning and value in his life in the same way that it has meaning and value in the whole spectrum of the public health community. I really thank each of you for your commitment, but there is a remarkable person sitting at the table on my left, Darwin Labarth, who has really, if Ginny Bales is the mother, I think Darwin is the father of the efforts to put this the division at CDC is born. It's official. We had a celebration at CDC to commemorate that, and we're very close to having formally appointed leaders recruited, so those acting titles will disappear from the division once and for all. And we know this is a baby. It needs nurturing and attention, but I think with your help and with the commitment that we feel at CDC, we'll be successful. So I just congratulate you on the next step in your progress, and really thank you for asking me to be here and have a chance to thank all of you. Enjoy the conference.